Hello, ladies and gentlemen. First of all, I wish you good health, peace, and energy. Today we will learn together about an important but often overlooked topic, which is high blood pressure and how to control it properly to protect cardiovascular health. I suggest you watch this video to the end because at the end, I will share with you 3 important tips on how to control blood pressure effectively. Many people are very concerned about high blood pressure, but not sure when they should be worried and when they shouldn't. Through this video, you will learn about these critical values and how to measure blood pressure accurately at home. You will also learn about the 3 golden rules to control blood pressure naturally without relying too much on medication. If you find this video helpful, please like, subscribe to the channel, and share with your friends to protect your cardiovascular health together. Thank you for watching and see you soon. Thank you for always accompanying the channel. First of all, it is important to understand how blood pressure works. Inside the body, you have a system of blood vessels called arteries. Imagine them as flexible pipes carrying blood, oxygen, and nutrients to each organ. As the blood moves through these arteries, it puts pressure on the walls of the arteries. That pressure is called blood pressure. Each heartbeat that pushes blood forward momentarily increases the pressure on the artery walls. When the heart contracts and pumps blood, it creates a pressure called systolic blood pressure. This is the higher number in a blood pressure reading. When the heart relaxes between beats, the pressure drops, and this is called diastolic blood pressure, which is the lower number. If you have ever had your blood pressure measured, you have probably seen 2 numbers like 125/70 seconds. The first number, 125, is the systolic blood pressure. It is the pressure the blood exerts on the artery walls when the heart beats. The second number, 72, is the diastolic blood pressure. It is the pressure remaining in the arteries when the heart rests between beats. Both numbers are important to understanding heart health. So what is normal blood pressure? According to medical guidelines, normal blood pressure is below 120/80 millimeters of mercury. If your systolic blood pressure is consistently 140 or higher, or your diastolic blood pressure is 90 or higher, you are classified as having high blood pressure. What does a blood pressure reading of 130/80 mean? Some new studies even suggest that a reading of 130/80 should be closely monitored. But don't panic. Having a single high blood pressure reading does not automatically mean that you have high blood pressure. Blood pressure must remain high for a long time to be considered a problem. Our bodies are not machines. Your blood pressure changes throughout the day depending on what you are doing. Climbing stairs, stress, drinking coffee, or even the anxiety of going to the doctor can cause a temporary increase in blood pressure. This is normal. It is the body's natural response to deliver more oxygen and nutrients to where they are needed. Such temporary increases in blood pressure are predictable and not necessarily dangerous. What matters is whether your blood pressure remains high even when you are resting. It is important to note that if you measure your blood pressure immediately after exercise, during emotional stress, or while talking or moving, the result is likely to be higher. For example, if you measure 140/90 immediately after exercise, it is a normal adaptive response, not a sign of disease. In the long run, regular exercise actually helps lower blood pressure at rest. Here's how to check your blood pressure to make sure you get an accurate reading. First, the cuff should be snug, not too tight, not too loose, with the tube running along the inside of the arm where the main artery is. Make sure the bottom edge of the cuff is about 2 finger widths from the elbow. You should sit comfortably with your back supported, your feet flat on the floor, not crossed. Your arms should be placed on a flat surface at the same level as your heart. It is very important to avoid talking, drinking coffee, smoking, or eating for at least 30 minutes before checking your blood pressure. Sit quietly for 3 to 5 minutes before taking your blood pressure. If you talk, move, or are emotionally unstable while taking your blood pressure, the reading will be falsely high. Let me give you an example. If I take my blood pressure while talking, feeling excited and moving around, the reading might be 154/83. even though my resting blood pressure is usually around 110/70. Does this mean I have high blood pressure? Absolutely not. It is just a reflection of the time of measurement and not my actual blood pressure reading. This is why it is important for you to measure your blood pressure properly. Ideally, measure your blood pressure twice a day, once in the morning before eating or taking medication, and once in the evening before going to bed. Take 2 readings in a row and record the average of the 2 readings. Do this for at least 5 to 7 consecutive days. Then share the data with your doctor. Here are 5 things you should know about blood pressure. 1. Don't trust a single blood pressure reading. It's best to measure it a few times and average the results. This will provide a more accurate picture of your actual blood pressure rather than a single reading that may be a sudden spike. 2. Use your non-dominant arm. If you are right-handed, measure on your left arm and vice versa. Once you have chosen an arm, always use the same arm for consistency. 3. Don't check your blood pressure too often. Monitoring your blood pressure multiple times a day can increase anxiety and can make your readings higher. Check it every few months or during your regular checkups, unless your doctor tells you otherwise. 4. Use a calibrated upper arm blood pressure monitor. Wrist monitors are often inaccurate. Look for lists of recognized blood pressure monitors published by organizations like the American Heart Association. 5. Be aware of the warning signs. If your blood pressure is very high, above 184 systolic blood pressure or above 124 diastolic blood pressure, and you have symptoms like chest pain, shortness of breath, severe headache, vision changes, confusion, or weakness on one side of the body, you may be experiencing a hypertensive crisis. Seek medical attention immediately. When should you go to the emergency room for high blood pressure? In these cases, you need to seek emergency medical attention immediately. These symptoms indicate that high blood pressure may be damaging vital organs such as the brain, heart, or kidneys, and delaying treatment can lead to serious consequences. However, if your blood pressure is high but you feel normal, the best thing to do is to stay calm, sit quietly, and measure again after resting for 5 minutes. Many temporary factors such as stress, caffeine, physical activity, and even talking can cause an immediate increase in blood pressure that will subside with rest. Rushing to the emergency room without symptoms can expose you to unnecessary medication, worry, and expense. Another important point to remember is that high blood pressure often has no symptoms. That is why it is called the silent killer. Many people live for years with dangerously high blood pressure without feeling sick, only to discover the problem after a heart attack, stroke, or kidney failure. The best strategy for early detection of hypertension and prevention of serious events is to monitor your blood pressure regularly and calmly at home. You can do this by following the tips in this video. One of the biggest causes of uncontrolled hypertension is consuming too much salt. The body needs sodium, which is an essential mineral, but most Vietnamese people consume double or triple the amount they need. One reason why you have high blood pressure could be because you're putting too much salt on your food. But it's not just the salt that's in the food you cook. It's also the salt that's hidden in many processed and packaged foods. Things like canned soda, cold cuts, frozen meals, snack foods, and restaurant meals. These foods often contain high levels of sodium, even if they don't taste salty. And this can raise your blood pressure without you even realizing it. So what can you do to lower your blood pressure naturally? Well, start by cutting back on processed foods and cooking more fresh meals at home. Use herbs, spices, lemon, garlic, and vinegar to add flavor to your food instead of salt. And when you do use salt, be sure to measure it out carefully. No more than half a teaspoon per day. It's also important to learn how to read nutrition labels. Check the sodium section and choose foods that have less than 140 milligrams of sodium per serving. Some people say that they get their sodium from Himalayan pink salt or sea salt or other premium salts. But these salts are mostly sodium chloride, just like table salt. so use them in moderation. You don't need to cut out salt completely from your diet. It's actually an essential nutrient that helps with nerve function, muscle contraction, and fluid balance in the body. Fruits, vegetables, meat, and dairy products all contain some sodium, so the salt that's naturally occurring in these foods is usually enough for the body. Lowering blood pressure doesn't have to be complicated. First, eat more potassium-rich foods like bananas, sweet potatoes, spinach, avocados, beans, and yogurt. Potassium helps counterbalance the negative effects of sodium by relaxing the blood vessel walls and helping the body get rid of excess sodium through urine. So by eating more potassium-rich foods, you'll naturally lower your sodium levels, which will help lower your blood pressure. Another thing you can do is focus on fresh, unprocessed foods. These types of foods are naturally high in potassium and low in sodium, which is a double benefit for your heart health. Next, maintain a healthy weight. Being overweight makes your heart work harder, putting more pressure on your arteries. So, losing just 5% to 10% of your body weight can have a big impact on lowering your blood pressure. Finally, don't forget about the other lifestyle factors such as regular physical activity, managing stress, avoiding alcohol and tobacco, and getting enough sleep. All of these factors are important for maintaining good heart health. Now that you understand how sodium, potassium, and lifestyle habits affect your blood pressure, discover the powerful role that foods and daily habits play in naturally protecting your arteries. Incorporate these simple strategies into your daily routine to strengthen your cardiovascular system, improve your energy levels, and significantly reduce your risk of heart disease and stroke in the long run. Start with foods that have been scientifically proven to support healthy blood pressure. Among the most effective are leafy greens like spinach, kale, Swiss chard, and arugula. These greens are packed with potassium, magnesium, and nitrates that help to dilate lymph vessels and improve circulation. Just one serving of green leafy vegetables a day can make a big difference over time. Berries are also a powerful ally in blood pressure control. Blueberries, strawberries, and raspberries are rich in antioxidants called flavonoids, which have been linked to lower blood pressure. Eating a handful of berries a few times a week not only provides essential nutrients, but also protects against oxidative stress, which can damage arteries. 5 habits to lower blood pressure naturally. It's important to eat in moderation. Just 1 or 2 small pieces a day are enough to get the benefits without consuming too much sugar and fat. In addition to incorporating these heart-healthy foods into your diet, you also need to practice daily habits to increase the effectiveness of blood pressure control. First, prioritize hydration. Drink enough water throughout the day to keep your blood volume optimal and your circulatory system working efficiently. Second, practice deep breathing exercises daily. Inhale through the nose for 4 seconds, hold for 4 seconds, and exhale through the mouth for 6 seconds. This will activate your parasympathetic nervous system and help lower your blood pressure. Just 5 minutes a day can make a big difference. Third, establish a regular sleep schedule. Go to bed and wake up at the same time every day to reinforce your body's internal clock. A consistent circadian rhythm is associated with better cardiovascular health. Fourth, cut back on caffeine if you're sensitive to it. While moderate coffee consumption is fine for most people, too much caffeine can raise your blood pressure temporarily, especially if you're sensitive to it. Fifth, manage your screen time and digital stress. Constant exposure to emails and social media can increase anxiety and stress hormones, leading to elevated blood pressure. Set digital boundaries and spend more time outdoors. Want to know how to control your blood pressure? No, it's not about making big changes. It's about small, sustainable habits that make a big difference. Walking around the house, doing some stretching, or taking a short walk outside can get your blood flowing and prevent hardening of the arteries. Don't underestimate the power of mindfulness either. Simple moments of gratitude. Meditation or prayer each day can help reset your mental state and significantly reduce stress levels. Mental health is closely linked to heart health. Many people now ask about supplements, but lifestyle and nutrition should always come first. Some supplements, such as goatweed and coenzyme Q10, have shown to help lower blood pressure, but always check with your doctor before taking any supplements. Oh, and don't forget the drinks. Cutting down on alcohol doesn't mean giving up social experiences. Herbal teas, sparkling water, and natural non-alcoholic cocktails can be just as tasty, and they won't raise your blood pressure. The bottom line is this: small daily choices add up to powerful, sustainable changes. You don't have to overhaul your life overnight. Start by adding more leafy greens to your meals, taking an extra 10-minute walk each day, or practicing deep breathing before bed. Build good habits and watch your health improve. Here are 5 blood pressure myths that could be harmful to your health. Myth no. 1. High blood pressure always causes noticeable symptoms. As discussed earlier, high blood pressure often has no symptoms at all. Waiting for signs like headaches, dizziness, or heart palpitations before taking action is dangerous. By the time you feel these symptoms, significant damage may have already occurred. So the best way to prevent complications is to regularly monitor your blood pressure, even when you feel perfectly healthy. Myth no. 2. If your blood pressure is stable with medication, you are cured. In fact, medication only helps control blood pressure, not cure high blood pressure. Stopping medication without medical supervision can cause a dangerous rebound effect, increasing your risk of heart attack or stroke. Myth no. 3. Young people do not need to worry about blood pressure. High blood pressure can develop at any age, especially in the context of modern diets full of processed foods and sedentary lifestyles. Myth no. For anything above 120/80 is too high. Although it is true that a reading of 130/90 mmHg is considered the upper limit of normal, the reality is that even readings of 130/140 are already in the pre-hypertension risk range, especially when they persist for a long time. And myth number 5. Natural remedies are enough for everyone. Although lifestyle changes can significantly reduce blood pressure in many people, they cannot completely replace medical treatment when necessary. The best way to control blood pressure is a combination of making smart lifestyle choices and taking the right medicine when needed. Once your blood pressure has improved, you can't just let go of these healthy habits. Managing blood pressure is a lifelong commitment, like managing your weight or exercising. And it takes time and consistency to see results. So don't expect to get off your meds or change your diet drastically and then return to your old habits and expect your blood pressure to stay low. It doesn't work that way. You don't have to run a marathon, become a vegetarian, or give up all of your favorite foods to protect your heart. Small changes that you can sustain over time, such as eating more vegetables, walking daily, managing stress, and getting enough sleep, will gradually pay off. Each healthy choice you make strengthens your arteries and makes them more resilient.